Hey, Hillary from Apothecary and Company. Thank you for joining us on Digestion today. For those who don't know me, I own Apothecary and Company. I've been a pharmacist for over 20 years. I have a big interest in nutrition and functional medicine, so I like to commingle those together and present different type of um, ways of thinking about things. And this one's going to be digestion. So I'm going to share my screen. All right. So digestion, it begins with America's food. We do not have the best food in the United States and throughout the world. Over the course of time, our nutrition, our foods have been um, more, has poor vitamin content. We now have genetically modified foods that does a number on our digestive system as well as our just overall nutrition. So that plays a role. I'm not going to go too much further into the foods, but they are playing a role. Of course, because that's how it starts, right? We're putting the food into our mouth. So we also need to think about how and what is the digestive system. So it goes all the way from the mouth all the way down to the anus. So it is a big system. And with that big system, there's various things that can happen, and we have more potential for something to occur, causing a disorder, a disease, or a symptom. So we're going to kind of go down that system as we talk today. But it all starts with chewing. And, I think in a society nowadays, we are just too busy. We do things very fast, and we are not a society that just sits and appreciates, talks, um, chews our food slowly. So they've done some research about this, and they found that researchers found that chewing food thoroughly 40 times before swallowing instead of the average 15 times actually decreases the hunger, the preoccupation with food, and the food intake in healthy adults. There's other studies that show chewing regulates our satiety and hunger hormones by increasing another hormone that suppresses appetite and promotes fullness. So if we were to just slowly chew things, on average 40 times or more, we become less hungry. We become more full. So it's nice. It's just we just have to take our time to relax and enjoy dinner and other breakfast, lunch. Chewing also improves metabolism as well, and we'll talk about that. So obviously chewing, we're breaking down particles, but we want those particles to be very small in size by the time they hit our stomach and our digestive tract. If not, then we're predisposed to having problems. We're more gassy, we're bloated, we could have more constipation, different food reactions. It's correlated with headaches and lower energy levels. So chewing helps with that. It also helps the secretion of stomach acid. We'll talk about that later too, but it also helps promote insulin. So there's some sugar regulation there. We also, when we chew, we'll talk about leaky gut, but when we chew, there is an enzyme that is secreted called epithelial growth factor. But what it does is it stimulates growth and repair for our digestive tract. So if our digestive tract is leaky, chewing slowly and more chewing times will help that. As we go down that track, we're going to the esophagus. So the esophagus obviously is good for swallowing, helps us swallow. There is a rhythmic movement called peristalsis. So our muscles in our esophagus will contract and relax, but that's what takes that food down to our stomach. And then once that reaches that right prior to our stomach, there's something called a lower esophageal sphincter. So basically, it's a ring of muscle that allows food to pass into the stomach. Sometimes that sphincter remains open, and that's what causes regurgitation and a little bit of reflux up into our throat. There are some good reports showing that actual melatonin helps strengthen that sphincter and close it. So that's pretty interesting. Um, Sometimes hernias come into play, uh, but that's all part of the digestive tract regarding the esophagus. So as I just mentioned, you swallow a piece of food and then you have this peristalsis movement, diaphragm does its thing, and you get all the way down to the stomach. But if these things don't work properly and something goes awry, well, we could have heartburn. We could have difficulty swallowing. That's called dysphagia. Sometimes we have chest pain. So that's a topic in itself, because is this chest pain due to heart attack or heart problems, or is it just more of a acidic environment because we have regurgitation because our esophagus is irritated? So all that has to be considered as well. And we'll talk about more of this as we go on. So now we're in the stomach. We're in the stomach chamber, or the chamber of the stomach. And the stomach is a muscular band that is churning food. We want it to churn. And as it churns and mixes the food, it's like a washing machine, really. It mixes with gastric juice. So that is our low pH. That's our stomach acid. And stomach acid, we'll come to talk about that, is a wonderful thing. We need the stomach acid. And then as a society today, conventional medicine loves to damper that, but it's going to cause more long-term effects. And we'll come to that in a minute. But gastric juice contains hydrochloric acid. It contains a digestive enzyme called pepsin, and then there's mucus in there too. But what the stomach acid does is help break down those food proteins, and it kills harmful bacteria. The pepsid will start doing the same thing. It's going to digest specific proteins, and the mucus is going to actually protect our stomach lining from this increased acid that we're using to digest our food. So it's a perfect situation. And there's purpose, and then there's protection behind that. So again, when you have multiple steps, things tend to go awry. And we'll come back to that in a minute. But so as the food is churned, it's broken down into smaller particles. We want smaller particles because it's easily to digest. We can get more nutrition from smaller particles. We'll talk about food intolerance. That will play a role in particle size as well. So the pepsin and the stomach acid, they work together to digest the proteins, carbohydrates, fats, all types of food that we may be eating. Behind that, we've got to be mindful that any sort of nutrients, water, alcohol, medications are also being directly absorbed from the stomach besides the food. So if we don't have enough stomach acid, or we're maybe drinking too much alcohol, we may not have enough, or we may not be getting enough nutrition from our diet. We may not be absorbing our medications properly. So those are all factors that need to be considered. When food is finally mixed and it's just broken down into, I guess, mush is what I will call it, it forms a thick mixture called chyme. So if you see that terminology, that's what that is. And then it travels down the stomach. Now we're on the bottom part of that stomach, and the muscle at the bottom part of the stomach opens to allow that mixture to pass into the small intestine. And that's where we get more nutrient absorption, and we continue that digestion process. So now we're going to move to the intestines in a moment. But stomach acid, stomach pH. So in here, our cute little pH scale here, gastric acid is number one in the pH scale. That is very, very, very acidic. It is secreted by our stomach lining, but it's very important. Other than breaking down food that we just talked about, it is wonderful at killing bacteria. So there's some diagnoses out there. H. pylori, there is small intestinal bacteria overgrowth like SIBO, there's Crohn's. We're not going to get into the specifics of those type of disease states, but we are going to know from this slide that any sort of high pH, so it would be more basic. So the higher pH, we're getting more into the water and the baking soda mixture. We do not have the capability of killing bacteria. So in our gut, we'll talk about, when we talk about probiotics, we have good bacteria, bad bacteria. We want our good bacteria to overpower and downplay our bad bacteria. But when you don't have enough stomach acid to kill out that bad bacteria, then we're gonna be underbalanced, and we could promote bacteria overgrowth, and that's not good. So it's very important at killing bacteria. Killing bacteria even could be food illnesses. You could be eating something in the E. coli on a piece of chicken, and your stomach acid has the potential to neutralize that and kill it to a certain extent. So, I mean, even just foodborne illnesses, the norovirus, it still needs to kill those bacteria. And then absorbing nutrients. Acidity is very important at absorbing certain nutrients. And if you neutralize your stomach too much, you are at risk of having vitamin B12 deficiencies, iron deficiencies, something called ferritin, which is your iron stores. You will have calcium deficiencies, possibly. So we'll see a lot of maybe higher risk for osteopenia, osteoporosis. You'll have lower absorption of vitamin D. You'll have lower absorption of maybe magnesium. So when I look at blood panels and I see someone is low in iron, low in B12, low in vitamin D, I know we have a gut potential problem. So stomach acid is huge at helping absorb nutrients. Know that as you age, though, stomach acid will decline. So we almost expect that. And we'll talk about what that looks like later. Digestive enzymes are also very important. We just talked about how chewing stimulates these digestive enzymes, but know that there's certain ones out there. So we'll see lipase, and lipase is responsible for breaking down fats. That's produced by our stomach and mouth and our pancreas. We'll see proteases. You'll see the word pepsin and trypsin. Well, those will break down the proteins into amino acids. And why would we care about amino acids? Amino acids are what causes growth in muscle, to sustain our muscle mass. As we age, we lose muscle mass. So amino acids are very, very important. Sucrase, that's secreted by the small intestine. It breaks down sucrose, such as table sugar, so it helps absorb nutrients into the bloodstream. So you'll see that word. You'll see amylase, that digests carbohydrates. So again, that's a sugar. It breaks down sugar. Maltase breaks down sugar. Lactase, of course, that's probably the most common one that we all know, is a sugar found in dairy products. So if no lactase is formed by our stomach or intestinal tract, we can have more gas or upset stomach. We'll talk about lactase in a minute. But overall, what we're not really concerned about, is all this needs to work in conjunction to have adequate digestion. Sometimes that won't happen, and we rely on digestive enzymes supplemental wise. So when you look at the prescription or the supplement label on the back of the bottle, you'll see all this words, and then you know what they mean. Conventional medicine, I had a talk with a physician assistant friend of mine yesterday, and there's no middle ground. And I think that's where functional medicine, that's where integrative medicine shines. We do not, until we have a definite problem, conventional medicine does not do anything about it, right? It's got to be like already done and gone into the extreme before we validate any symptoms. So in between this, there could be lactose intolerance, right? We know that you just can't digest the lactose from the dairy products because you don't have enough lactase produced by the small intestine. So that is your lactose intolerant. You may have dairy products, you're going to have bloating, diarrhea, abdominal pain, gas. That's lactose intolerance. But there's a few number of us, affects 65% of the people, that when you get into adulthood, You could eat all this dairy products, no problem, but one day, oh my goodness, I'm eating this ice cream and I'm miserable after, right? Um, it typically begins 30 minutes to 2 hours after eating or drinking dairy. So that is lactase non-persistent. So actually, you get lactose intolerant as you move into adulthood. So that's a thing too. So yes, if one day you could eat cheese and the next day you can't, sometimes it's just because of genetics. There's also something called secondary lactose intolerance for those people who have celiac disease, Crohn's, or any sort of inflammatory autoimmune disease in the gut. This just by chance happens, and it's just kind of a byproduct of that. The other thing is, and this is where I was talking about conventional medicine, it's like you got to take it to the extreme before they validate you. There's a process called exocrine pancreatic insufficiency. So there's a prescription medication called Creon that when your pancreas doesn't produce any sort of digestive enzymes, you rely on the prescription to do so. So, and that's the um, stronger strength of those digestive enzymes. Here, when we do digestive enzymes from a supplemental perspective, we're just dealing with baby amounts. So typically, exocrine pancreatic insufficiency is to the extreme, as I mentioned, but most of these people can't digest fats. So they'll have gas and bloating, abdominal cramping, diarrhea, oily looking stools, unexplained weight loss. So that's a possibility. We can get these natural things through the diet. I think we always have to talk about natural alternatives, and sometimes that will help. So when we talk about proteases that digest proteins, we can find that in mango, kiwis, pineapple. Amylases that digest the carbs, that can be found in um, actually, this is mango, this is papaya, bananas and honey. Lipases digest fats. That's actually found in avocado, which is interesting. Avocado is fatty in itself, so that's found in a fatty, a good fat uh, source of food. And then there's prebiotics, fermentable, kimchi, sauerkraut. We can find the prebiotics that go into that. My favorite are herbal bitters. So if I don't want to use digestive enzymes, which we'll talk about further, I'm going to resort to herbal bitters. So herbal bitters are a group of herbs. Historically, they've been in our foods, but because of our different farming practices, this has kind of changed as well. But they used it in the 18th, 19th centuries for medicinal use. They were common in all these pharmacies as a cure-all tonic. You'll find Angostura bitters. A German doctor cultivated that to help soothe soldiers' upset stomachs. So historically, they've been around forever. But what they do is they create a source of bitterness on your tongue, right? It's one of our taste sensations on our tongue, and it creates more saliva, which in turn jumpstarts our digestive system. So if I feel bloated and I just need help digesting food, I will put one spray or one drop on my, or dropper full on my tongue. I like the bitter taste, so I have no problem with that. But it will kind of help break down food because it's working behind the scenes. It's helping me secrete more digestive enzymes. This is a list of bitter herbs that we'll find in conjunction with all this. There's chamomile, angelica, dandelion, there's organ, grape, burdock, parsley, peppermint, chicory, yarrow. If you go over to the European countries, a lot of this is found in salad greens, right? They'll do dandelion greens, maybe they'll include parsley, all these things that are included actually in different food. Maybe chamomile tea, right? You can drink chamomile tea after a meal. The United States, America has gotten away from that, but that's where it shines is in the European countries, and they've been doing this for years. Stomach issues that we could be having that we see quite often here, food composition. So we've got a problem with foods that are high in fiber, high fat, high protein. If that's the case and you have a problem digesting it, then we need to look at maybe digestive enzymes or increasing that stomach acid. But People just nowadays cannot break up their foods properly. Another thing is, a good point to point out is it's not about foods, it's also about vitamins. So when people come in and they have a problem with digesting a simple multivitamin, depending on the brand, most of the time I say it's vitamin belly. That vitamin's just sitting there and just rotting your guts out, and it's not moving. It's not intended just to sit there, and that's why you're feeling sick. You got to digest that sucker, move it so you can absorb it. So a lot of times this is a vitamin belly issue. Stomach acid levels, when people come in, it's probably that they have low stomach acid levels, so then they're not digesting fast enough. We just talked about reduced enzyme activity that can lead to indigestion, stress and anxiety. We'll talk about that in a moment, but that can increase stomach acid production and lead to discomfort. And then just constipation and diarrhea alone, not moving those parts or moving them too much will cause discomfort and just overall ill feeling. One thing that gets downplayed and does not look um, we don't get a fair look at this, which is interesting, because I've seen many patients, and sometimes it takes to we're doing all this thinking. We're thinking about probiotics. We're thinking about how they're digesting. We want motility so they can poop every day. We do all these fancy tests, food sensitivity tests, food and GI stool test, and it comes back down to vagus nerve. So if you are extremely frustrated and have a lot of stress and you hold that stress, it will affect your vagus nerve, which then innervates or activates your digestion system. And you're in this fight or flight. So when you're in fight or flight, your digestion system just comes to a halt, so that plays a role. So mental health and stressors are very important to address when we talk about digestion. And in fact, there's a lot of different organizations that have different fields. So if you go to Henry Ford, they have a gastro psychology department. That's so cool to me. I love seeing that mesh. So vagus nerve is very important. Ways to support that vagus nerve, of course, is stress management techniques, meditation, yoga, mindfulness, just to get your body out of sympathetic, tense processes and go into what we call parasympathetic. So it just promotes relaxation. The other thing is mindful eating. We want to slow down, chew slowly. That in itself can stimulate the vagus nerve and improve digestion. And then incorporating probiotic rich foods. We need a good microbiome for the vagus nerve to work properly. So that plays a role. So vagus nerve, I'm not going to talk too much more about that, but just know that stress plays a huge part of that. Moving finally into the intestines, as I said a while back. The intestines, there's three things that I want to point out to that. Once you reach the intestines, there's the different parts, duodenum, jejunum, ileum, there's the large intestine, but we are so dependent on any of these for all these vitamin absorptions. Look at all this. It's huge. So when we have alterations to the physiology of these intestines, maybe bariatric surgery, maybe you have Crohn's and you had to get some of this removed, for whatever reason, if you have any sort of modification, we need to make sure that these vitamins, depending on what section was altered, needs to be addressed. Bariatric surgery is a big part of that. I think bariatric surgery is actually going to go by the wayside now that we have these GLP-1s out there. But we have to pay very important attention to getting enough protein, B12 again, vitamin D, things like that. So this chart's kind of cool for that. That kind of talks about surgeries. The other thing is maybe these parts are gone, but what if you have inflammation? What if you have Crohn's? What if you have colitis? What if these things are just so angry? If they are very angry, you're also not going to absorb these vitamins. So that plays a huge role. If they're angry and they're very inflamed, you're Maybe you can have excess diarrhea. Maybe you are not having good bowel movements and you're constipated. So it all comes down to just basically the functionality of all this. Speaking of bowel movements, different types. The most notorious stool chart is called the Bristol stool chart. And depending on the type of stool we have, we are going to be considered severe constipation all the way up to severe diarrhea. What we're shooting for is type 3 and 4. If we don't have that type, then we've got to do different things. Is it a probiotic? Is it you have too much motility? So we'll talk about that. But we're shooting for type 3 and 4. It is also very important that we need to talk about how frequent we're going. I am shooting for, some people say you want to have a bowel movement after every meal. Some people say you need to have a bowel movement at least once every day, as well as a good size. That's what I stick with, to be honest. After every meal is completely fine as well. But if you don't have that, then we've got two different possibilities. We could be diagnosed with constipation. The conventional label of constipation is a patient must have experienced at least two of these symptoms over the past 6 months. So 25% of the time. If you are straining more than 25% of the time, if you have hard stools more than 25% of the time, incomplete evacuation, if you don't feel like you've got more in there and you're not getting rid of everything more than 25%, you're considered constipated over the past 6 months. Anal rectal blockage more than 25% of the time. If you have to use manual maneuvers to have bowel movements more than 25% of the time, or just simply having fewer than 3 bowel movements a week. I'm going to tell you that the younger population, the teen group, and probably the people who are even in their mid 20s, 30s, they think that having bowel movements once or twice every week is normal. It is not. So we've got to change that mentality. We also got to change the mentality of just, it's okay, let's talk about it. Someone comes in and they want to know what kind of magnesium to use. That's the first thing we talk about. Are you a good pooper or a bad pooper? So we got to normalize that talking about bowel movements is okay. On the flip side, if we talk about diarrhea, a person who has loose or watery stools more frequently than normal, 3 or more times a day, that's considered diarrhea. Of course, you can have acute diarrhea that lasts 14 days. Some stomach bugs would be considered that. Or if you have diarrhea 30 days or longer, it can be associated with irritable bowel syndrome. I will mention this though, in my 2 cents, and again, this is just Hillary's viewpoint. It's kind of, they like to put umbrella terms to have everyone be covered under that to be labeled or diagnosed. So irritable bowel syndrome is just an umbrella term. It could be irritable bowel constipation, irritable bowel diarrhea, maybe both of them, but that doesn't really tell us what's the why be? Why is this even happening? So I'll get off my soapbox and just leave it at that. But irritable bowel syndrome does not give us a clear definition of what the heck's going on. We got to talk about the gallbladder. So gallbladder has to do with digestion as well. I see a lot of people that do have gallbladder issues coming in, but before I get into those, I think we need to talk about what its job is. And the liver next to the gallbladder produces bile, and then the bile stored in the gallbladder. But when we eat any sort of fatty food, the gallbladder will then secrete that bile, and then it will push it into the small intestine. So then we can process our fats. The bile breaks down the fat, and then into form it can be digestion. But where we see a problem is when people come in and they're having these sort of pains, right? Symptoms, gallbladder problems could be upper shoulder pain, which I'll come back to, back pain, sharp pain in the upper right abdomen, nausea, vomiting, loss of appetite, bloating, indigestion. That's kind of like the norms. If we get into the extremes, then we're looking at jaundice, yellowing skin and eyes, maybe fever and chills. Maybe that's an infection. Clay colored stool and dark urine. But again, Conventional medicine loves to address problems when they're at their worst, not a preventative. So when we look at um, gallbladder problems and a physician orders imaging, I put on here to scan or not to scan. That is the question. A lot of people who do come in and say, I had gallbladder imaging, will come back fine. They will see no evidence of gallbladder disease or stones, and they're still having these problems. So don't be discouraged if something's coming up negative, because if you still have the upper shoulder pain common at night, kind of under the scapula, back pain, sharp pain in the um, right upper abdomen, it all could be part of the gallbladder. Coming to the causes though, when I do my hormone consults and people who have had hysterectomies, I dare say 80% of the people who have had hysterectomies have also had their gallbladder removed. Know that because we are in such, and this is another talk, um, know that if we have too much estrogen, and most women nowadays do because of various reasons, it will sludge up the gallbladder. So it isn't that our gallbladder is infected or it's blocked, it becomes sludgy. And those sludginess problems will then reflect into these symptoms that they can't catch on imaging. So hormones, people who are on birth control sometimes will have gallbladder problems. So it's about clearing and making sure we're using these hormones properly. Sometimes if we don't have a good microbiome, our good bacteria in our gut, that will kind of play into gallbladder problems. Nutrient deficiencies, simply being deficient in magnesium or choline or even B vitamins will play a role. Sudden weight changes will cause gallbladder problems. Low fiber, high carb, high fat meals will cause gallbladder problems. So if we think about it and just do a deep dive into history and maybe just what's going on with lifestyle, we'll get a pinpoint of maybe it is a gallbladder problem without being justified on imaging. The other thing is blood work, looking at what we call a complete metabolic panel. So your standard blood work, looking at liver enzymes, looking at something called GGT, will give us an idea if it's gallbladder problem. If you do have gallbladder support, it doesn't mean you want to jump into this hardcore, because if you do, then you're probably going to cause more problems than not. But it's just working up to that point. So again, if you're not taking magnesium, B vitamins, if you're not getting a good probiotic, that's the starting point. And then if you still continue having this type of problem, then we look into blends that good professional companies make. This one is by Seeking Health, Ben Lynch's product, and it has noticed these bitters in there, everything that we kind of just talked about, things, herbs to help support the liver, that will kind of push the gallbladder into the way it's supposed to act. But again, there's a right way to do that. So it doesn't mean go out there and buy this and choke down 4 capsules. There's a systematic approach. Acid reflux, if we go into acid reflux, do first thing, it's kind of like, are you a good pooper, bad pooper? Do you even have high stomach acid? Unfortunately, not unfortunately, it's kind of thrown at us and assume that we do have high stomach acid, um, and that we need to neutralize it and settle it down. It's not the case. There's proton pump inhibitors, there's Prilosec, Nexium, there's Prevacid. But what they were originally intended when they first came out was to be taken only for 14 days. That's why you see 14 tablets, 14 tablets. It was never meant to take more than that. There's certain situations where there are to heal the gut for maybe ulcers, maybe if you were diagnosed with Barrett's esophagus, sorry, proton pump inhibitors is a lifelong thing, but it's better than maybe predisposing yourself to increased cancer risk. So we'll take it. But if you are on a proton pump inhibitor, we got to think, well, do you need it? Number one. Number two, if you don't, we need to come off of it with the blessing of your physician and have a discussion go in that direction. But if you are to have ulcers and Barrett's, they're very helpful. The downside of conventional medicine is that we never have a talk about when to get off these medications. It's like you're stuck. They forget about it. So if you are questioning if you need to be on it, please reach out to your physician and say, hey, can I do a trial? If you changed your diet around, if you've changed just lifestyle around, maybe you don't need it anymore. So don't just stay on it because you're on it. Proton pump inhibitors also you have a higher osteoporosis risk. As I mentioned, when you decrease stomach acid, you don't absorb the magnesiums, you don't absorb the vitamin D, you don't absorb the calciums. So your osteoporosis risk will go up. We also talked about how they kills, our stomach acids kills bacteria, specifically H. pylori and SIBO. So the risk of co-infection is up there too. But the main thing that we have to consider is if you come off of that. So if you've been on Prilosec, Nexium, a proton pump inhibitor for just, I don't know, 1 to 2 months, you're likely can just stop it, no problem. 2 months is probably pushing it, to be honest with you. Let's just say 1 month. Once you are taking it every day, based on length of time you've been on it and what dose you're on, if you want to get off of it, you've got to consider doing and weaning it off. Otherwise, those proton pumps that secrete the stomach acid are going to come back with a vengeance. You're going to think, "Oh my goodness, I really do need this product." But in reality, it's just you didn't come off of it slow enough. So it often takes 3 to 6 months. You got to do it right. You've been on it for years. There's no rush in getting off of it. So weaning off is very important. And if your doctor doesn't know how to do that, always reach out to your pharmacist. They have resources to direct your physician. If you have low stomach acid, again, you have a increased susceptibility to weak cracked nails. Maybe you'll have more heartburn and GERD. Maybe you'll have more yeast or candida, bad breath, undigested food in the stool, irregular bowels. You might have more apt for food sensitivities, allergies, intolerances, intestinal infections, deficiencies in minerals and vitamins. So low stomach acid is not good. It is not good at all. And there's a challenge that we can do to see if indeed you do have low stomach acid. So this is our challenge. There's two ways of doing it. There's the baking soda challenge method, or there is the apple cider vinegar. So what I like to do is, okay, we'll take 2 tablespoons of undiluted apple cider vinegar, put it in a shot glass, fill it up with water, and drink it. If you feel that your acid is coming back with a vengeance and like, oh, it's killing and burning your stomach, then you probably have enough stomach acid, and that's fine. Maybe even have too much, and PPIs or Pepsid or something like that's warranted. So if that's the case, then you just take Tums or baking soda water to quiet it. But if you eat a meal and you have heartburn afterwards and you take apple cider vinegar and that goes away, you know that you likely do not have enough stomach acid, and that just provided that for you. So that's a kind of at-home test. There's the baking soda challenge too. So where you mix 1/4 teaspoon of baking soda and some water, you drink on an empty stomach first thing in the morning, set a timer as soon as you start drinking it, and you wait for a burp. If you do not have any burps after 5 minutes, you may have low stomach acid. So there's cool little tricks there. Moving into leaky gut. Leaky gut is a big term. Conventionally, it's not recognized. There's no diagnosis code of leaky gut. Basically, what it means is our gut wall is 1 cell thick. So this is the cell. On one side, we have our bloodstream and our immune system. The other side is where you have the food. So as time goes on, and we don't have enough vitamin D. We have maybe not enough omega-3s. Maybe we have certain triggers. Maybe we have chronic stress. Maybe we've been on antibiotics for a long term, even in our childhood. All those kinds of different factors will start breaking down this wall. So now you have no barrier. You eat these foods, you got your immune system right here. Soon, these foods, these toxins, these bacteria pass on to your immune system or your blood on the other side. And your immune system, all it knows to do is to attack. So these attacks can be wherever your body has its weakest link. So, for instance, for me, when I did my food sensitivity test, because I battled with chronic constipation for years, I would eat a beef protein, just regular beef. That beef protein, probably due to the lack of digestion, was bigger than normal. Passed through these walls. My immune system attacked it because no beef protein should be in your blood system. And at that point, my weakest link was my knees. So I was having knee inflammation, knee pain. So that's kind of the idea of leaky gut. Again, it's not a diagnostic thing, but it certainly, there's enough literature to suggest that it is true. Leaky gut affects more than just our gut. So if we have a leaky gut, sometimes that's gas, bloating, diarrhea, constipation, sugar and carb cravings. Maybe you have IBS, IBD, celiac, vitamin deficiencies. You have anemia, so you don't have enough B12 or maybe iron. But non-digestive association is frequent illness. Maybe you have fatigue, headaches, rashes, eczema, acne, joint pain, brain fog, ADHD, depression, lupus, throws you into an autoimmune disorder. There's a huge correlation with all this. And the thing is, that's why we turn to integrative and functional medicine, because we need to hear a life story that often takes 2 hours to kind of get an idea of what's going on. If you look at this and you have leaky gut and your primary care provider doesn't know what the heck is going on, you've got the potential of going to a rheumatology, allergist, gastroenterology, maybe dermatology. So that's where when that patient comes in that's been to 50 million specialists ends up here. That's my favorite, because that's often comes back down to gut. I mentioned some of these. What are the triggers of increased what we'll call intestinal permeability? You'll see that as leaky gut. We talked about stress, infections, your microbiome's off. Diseases in itself can cause it. Medications can cause it. Years of birth control can be a factor in that. So it all is part of the puzzle. How do we heal the gut? Typically, it takes 6 to 9 months for that gut to just kind of simmer down and do what it needs to do, on average. So we need to look at vitamin D3. We need to maintain levels of at least 50 in our blood, which takes an average about 5,000 units a day. We need to identify the food triggers, right? Mine was beef. I needed to identify that and take it out so I wasn't harming my gut as we were healing it. I need to identify good probiotics. There's supplements called glutamine, licorice, aloe. That all helps seal that gut wall up. So here, this is our GlutaPro. You take 1 scoop a day, and these combinations kind of heal that gut up faster than if you were not to use supplements and just use takeout diet. A lot of times, unfortunately, as a society, we don't have time for an elimination diet. It just doesn't fit into people's lifestyle. And this is where this kind of comes in. Gut microbiome, good bacteria, bad bacteria. We're looking at the big picture, but just know, and again, functional medicine, integrative medicine is evidence-based medicine. Everything that we say has science to back it up. So if we were to pull a collection of all studies about the microbiome and the gut, good bacteria, bad bacteria, it's linked to all these things. Reproductive system, there's skin, bladder, muscles, heart, bone, kidney, everything. So gut microbiome is huge and very important. As we talk about probiotics, it could be a subject in itself, but just know that to feel better, to get a clinical result, we have to go to a professional line of probiotics. For example, if we look at the one on the left right here, this is a line. A line has bifidobacterium in there. It has 5 billion CFUs when live, but it has milk. Why in the heck are we giving people who are often sensitive to dairy and milk, which is inflammatory in itself? Why are we combining that with a probiotic? Doesn't make sense. I don't think it's necessary. So I don't care for a line personally. The other thing is a lot of people come in, I take Activia, I'm covered. Well, Activia has the same bifidobacterium, 3 billion of live probiotics, but this is just packed with sugar. Sugar, sugar, sugar. Well, sugar is inflammatory. Sugar feeds candida. So if we have a yeast problem and we're giving probiotics, this certainly is not helping us. So maybe good just for the norm, but people who are looking for information that I'm giving you, you're kind of beyond that. You're looking into what we call professional lines of supplements. So we're looking into standardized blends of what lactobacillus and bifidobacterium. Those are the two main strains that all these other ones form off of. And they have a decent amount. They're 15 billion. So this is my starting point. There's 50 million different kinds of probiotics out there. Some are more towards constipation, some are more for weight loss, some are more for diarrhea, but this is kind of like run of the mill in the middle. Good starting point. But notice here, right? All it has is cellulose, silicon, magnesium stearate. Very, very clean. Here we have some titanium dioxide color, some gum. It's just so much stuff. So we're looking for clean, simple, and therapeutic. We do offer, or we do recommend that you change up your probiotics every 2 months. We don't want your body to get used to these two strains. We want them to kind of just diversify over the course of time. So we find two blends or two different capsules that we do like, and we'll go, 2 months on one, 2 months, and we'll rotate. Food sensitivities, that's a whole nother thing too. So for people who don't have the time to go eliminate and try to food log, and sometimes our life doesn't allow for that, we can just do food sensitivity tests. So this is what's called IgG test. If you were going to go to the allergist and look at what we call IgE, it is an immediate response. So if they skin prick you and you're allergic to lobster and your throat closes off, that's immediate response. Here, a lot of our food sensitivities are delayed. So that's what we're looking at, is what's called IgG. I eat beef on Monday, my joints won't hurt until Wednesday, Thursday, maybe Friday. This is what this identifies. Completely different immune response. But that's what's appropriate to look at when we have leaky gut. So there's also, besides identifying what type of food you are sensitive to, remember it's not an allergy, it's sensitive to, we'll look at candida, zonulin, occludin, and LPS. These three markers, zonulin, occludin, and LPS, are suggestive of leaky gut. It is not diagnostic. It doesn't tell you have it, but if your food sensitivities are lighting up like a Christmas tree and you have positive of zonulin, occludin, and LPS, I'm like, yes, leaky gut it is. So it's all, you kind of have to look at that big picture again. Those are very beneficial. And if you don't have the time to cut out the most inflammatory foods, dairy, eggs, corn, gluten, and maybe you did do that and you're still having food intolerances, I would have never caught beef if I didn't do my food intolerances. This is where it serves useful. These normally run about $390. It's not like you have to retest again. So it gives you a snapshot. I will caution you to use, there's other ones that are available online. The thing I've got, again, I'm probably putting myself on a soapbox. I don't agree with those because people will take that sort of information, retract and stop eating those foods, but you're never sealing the gut up. So it takes a good functional medicine practitioner to kind of coach you through that process to see good results. Otherwise, it's just going to keep on um, getting worse. This is the type of thing that it looks like. So they'll rate your different reactions. There's +4, +3, +2. +4 are your more severe. That's what's probably causing more effects. So there's that. What we're shooting for is pulling those all off, reintroducing these things slowly, and there's a process to do that in 3 months while healing the gut. And often you can go back to eating those later. There's a thing about gluten sensitivity. I think a lot of people do dismiss that. When we think about gluten allergies, that's true celiac, right? That's a genetic thing. But gluten sensitivity is a thing that runs very personal for me because when my son was probably 2, 3 years old, we had a lot of behavioral issues. And I thought it was just a terrible two situation, but it wasn't. And for whatever reason, my mom one day said, I wonder if it's gluten. And he was very just disrespectful, just no, oh, it was bad. Just no remorse for pinching, hitting, just out of control. I pulled gluten off his diet, completely different kid. So even just from a gut standpoint, gluten sensitivity is huge for behavior as well. There's different types of alternative testing out there. When we can't figure out something or people are just beyond, they've been through the gamut of specialists and gastroenterology can't figure them out. This is my favorite type of test. It's through Genova Diagnostics. It's GI comprehensive stool analysis, but it will tell me how you're breaking down proteins. Do you have enough digestive enzymes? Are you riddled with inflammation? If you have too much of this IgA, we know it's more of a food intolerance thing. So it will give us direction. This short chain fatty acids, and I didn't mention this with constipation, we are looking for fiber content. Fiber stimulates gut motility. And if your short chain fatty acids are low, I know that you don't have enough fiber in your diet. So it really pinpoints actually what's going on for the people who are having trouble. Things to consider: constipation, wrapping all this up. Um, make sure you're on a probiotic, make sure magnesium citrate, 300 to 400 milligrams at bedtime. Those two are the foundational things. A lot of times, just simply adding magnesium makes a world of difference. Actually, we had someone call and that's all they needed the other day. Probiotics, that's again foundational as well. If those two things are not working for you, maybe over the course of 4 weeks, then we start moving and looking into other things. Aloe capsules are wonderful. That's more of a laxative effect. It's not something that you'd want to use every day, but it's better than senna in my opinion. Digestive enzymes, maybe we need to add some of that in there. I just talked about fiber, increasing fiber. We're shooting for 35 grams of fiber a day to kind of keep that digestive tract moving. Do we need to consider vagus nerve motility? Do we have to move into testing? Pure Encapsulations makes a capsule called Motilipro, and it has ginger in there to stop inflammation, but it has 5-HTP. So 5-HTP is a precursor to serotonin. Serotonin's needed to stimulate gut motility too. So this kind of feeds that process. Maybe you just need smooth move tea. Maybe that has senna in there, and it's a sweet tea. I enjoy actually drinking it, and sometimes I need that just to get me moving for occasional constipation. So there's a lot of different things out there, rather than just the typical over-the-counter stuff. Diarrhea, what if you have diarrhea? Well, we can look at probiotics again. There's certain strains that are better for diarrhea. Magnesium, I say this because I had in a consult the other day, actually, magnesium, she was taking magnesium oxide 500 milligrams. I don't regularly recommend magnesium oxide just because it's not readily absorbed, but that was causing too much bowel movements for her. She was having to take Imodium just to go to work. So if we pulled off magnesium, that should be good. Digestive enzymes are part of that. Maybe it's a fat thing, breaking down the fat, breaking down the other um, foods that will help promote the diarrhea. Fiber, It's fiber is kind of like, it's kind of interesting because you take fiber, it will help diarrhea, but it'll also help constipation. So fiber will help bulk up the stool. Vagus nerve again, and then do we need to move into testing? Bloating, carminative compound is great. That is awesome. We, other than just like gas X, this tends to work good. It also has a bitter component to it, so you get the digestion that that's being helped too. Probiotics. Some people will come in and say, "I'm just bloated." Well, try a probiotic. Sometimes it goes away. So foundationally, probiotics is my first go-to. Then you can kind of frog around. Do you need to add digestive enzymes to help break down that food so it's just not sitting there causing bloat? Do you need to add ginger in? Ginger tea is good. Bitters, as I just mentioned, these carminative drops are our favorite. I'm going to mention small intestinal bacteria overgrowth. That's called SIBO. That's in a whole discussion of itself, but I'll just leave that out there. If you haven't looked into that, that's something to possibly research a little bit more. What if you have heartburn and indigestion? Well, we talked about ginger. That's good, and ginger tea's helpful at times. If you have to go beyond that, then we can consider adding a digestive enzyme. Here is our digestive enzyme. It's called Enzyme Max, but this is what it looks like. We just talked about all this type of stuff, right? But it has betaine in there. That's the replacement to our stomach acid. We have something called Enzyme Essentials, I believe. It does not have that betaine in there. So if you don't need the stomach acid help, then that one would be more appropriate. But if you feel like you need a replacement in your stomach acid, this is where this one comes in. Simply just drinking apple cider vinegar. Some people don't want to do these fancy types of capsules, and apple cider vinegar is completely fine alone. And then I mentioned bitters. So overall, again, just the big picture, what do we need to look at? Vitamin D to support gut health, probiotic. Are we dealing with just permeability issues? Are we dealing with food sensitivities? Do we need to move on to testing? So there's different like thresholds, different tiers of approaching everything. And I think that summarizes it. That's gives you enough information to get your mind wandering. Of course, if you have any questions, holler, stop in. But I thank you for joining us.